An estimated 2 to 8% of college students are diagnosed with ADHD. The exact percentage is difficult to determine because most studies rely on self-reported symptoms. Medications can help alleviate ADHD symptoms, but shouldn't be the only treatment college students are reaching for. ADHD medications can be easily abused or misused, but first let's talk about the medications themselves and learn more about them.
So first we're going to talk about what medications are available to treat ADHD, and it pretty much comes down to two main categories: stimulant medication and non-stimulant medication. So, stimulant medications are the most abusable and most common medications that you'll see being prescribed to people for ADHD. It comes down to two categories: amphetamines and phenadates. In the amphetamines, we see Adderall, dextrolevoamphetamine, Dexedrine, dextroamphetamine, Vyvanse, lisdexamphetamine, and Desoxyn, methamphetamine. In phenadates, we see the brand names Ritalin, Focalin, and Concerta, with the generics methylphenidate and dexmethylphenidate. It's important to note that methamphetamine, while used for ADHD, is very rare and you won't see it very often. Going by the dopamine hypothesis of ADHD, saying that most of the major dysfunctions come from a lack of dopamine in parts of the brain, these medications work on the CNS by modulating the amount of dopamine and norepinephrine. The areas affected aren't yet fully understood, but it's thought to be the inferior frontal lobe and striatal regions. For the non-stimulant medications, first we come to atomoxetine, which is the specific norepinephrine reuptake inhibitor. What this means is that the reuptake of norepinephrine is inhibited, allowing more norepinephrine to stay in the synapse. When it comes to the tricyclic antidepressants, they work almost in the same mechanism as regular SSRIs. However, SSRIs are a lot more selective, which means they have fewer side effects. With tricyclic antidepressants, they work by preventing the reabsorption of neurotransmitters called serotonin and norepinephrine. This reuptake inhibition is what usually leads to the cascade of effects that help prevent ADHD symptoms. With bupropion, we see the pharmacology of this is quite similar to some of the other things that we've been seeing when it comes to treating ADHD, which is norepinephrine and dopamine. This chemical is a norepinephrine dopamine reuptake inhibitor, which means that it allows more dopamine and norepinephrine to stay in the synapse. It's important to note that these SSRIs, SDNRIs, and what have you are prescribed a lot less than your traditional stimulant medication because they have a lot more side effects. Lastly, in the others, we see modafinil, which could be considered a step between caffeine and Ritalin. We also see beta blockers like propranolol, which work by reducing physical symptoms that you may see with ADHD, such as high blood pressure, uneven heartbeat, tremors, and stuff like that. Basically, taking beta blockers allows your body to calm down a little bit.
Here's how medications can help reduce the symptoms of ADHD. Neurons in the brain pass information back and forth. When they are not able to do this, it affects our attention, motivation, and other ADHD symptoms like restlessness and impulsiveness. Medication helps neurons pass these messages from neuron to neuron. Medication works in 8 out of 10 people. While they are not a cure, they help train those neurons to communicate when they don't naturally do so. Some of the symptoms that medications can help with is poor concentration, unstructured behavior, ability to pay attention, ability to listen constructively, ability to focus on tasks, ability to follow through with tasks, forgetfulness, impulsivity, and hyperactivity.
The side effects of these ADHD medications are, but not limited to, stimulant neurotoxicity, slowing of height/weight growth in children, insomnia, loss of appetite, anxiety, dry mouth, tics, negative affect, nervousness, irritability, depression, hypertensive crisis, hyperhidrosis, headaches, stomach aches, fast heart rate, high blood pressure, rebound/addiction, tiredness, pupil dilation, etc. The list is very large when it comes to the potential side effects, which is why it's super important to only take the medications as prescribed and when you're prescribed it. When you don't have a doctor assessing you every so often to make sure that you're within the right weight or height limit, then it can get pretty tricky when dealing with all the unnecessary side effects when it's abused. This video is an excerpt from a YouTube guy named CG Kid. He goes and interviews people with past addictions and who is in recovery himself. He has a non-biased approach and gives subjective effects of what the Adderall is like.
And keep in mind, we're talking about Adderall abuse for someone who doesn't have ADD. I have a podcast on Spotify. I'll link to the description. It's a far different thing when you're taking it medicinally for ADD versus abusing it. So that's what we're discussing within this video.
What are the effects from abusing Adderall?
So the effects of Adderall were, I would take the Adderall and within 30 minutes, I felt the effects. I knew the drug was in my body. I was very awake. I was very alert. I was very energetic. I almost felt happy. I thought I felt very happy. And I was just wanted to do I wanted to do tasks. I just wanted to just do stuff and just do little, clean, whatever it was. I just wanted to do stuff. We call it tweaking. And that's what I was doing. I was tweaking. I was doing a lot of stuff, but getting nothing done. Also, when I took Adderall, the craving for alcohol was magnified. I always noticed that when I would take Adderall, I would crave alcohol nonstop. I would crave nicotine nonstop. I would want to smoke. I smoked large amounts of cigarettes as a result of being on Adderall. I would take so much Adderall that I was grinding my teeth. I was twitching. I took so much Adderall, I was paranoid. I became paranoid where I didn't want to leave the room, which was a result of lack of sleep. I would never sleep. I also took so much Adderall that I would eventually go into what's called a speed blackout. I would literally pass out and black out. I was taking large amounts of Adderall.
After being prescribed, when did you start abusing Adderall?
I thought I started working them then. I'd say, listen, I need to have my medicine because I study better. And they agreed. They just didn't know. They just didn't know. They said, okay, let's do it. And, back then it just wasn't on the radar as an abusive drug. It was the miracle drug, I started abusing it probably when I was 21. It was really my Adderall and Ritalin intake really increased when my alcohol intake increased. And then once I was drinking and I mixed Adderall with the alcohol, I was like going, now I like this recipe. Now we're going to a whole new level. Alcohol, something happened. I went, the alcohol started not working, and then I started getting hangovers, and then I took Adderall and the hangover went away, and I was able to perform and work all day long, party all night long, and perform normally. Man, I'm that guy. I'm a functioning alcoholic. Okay, no, I wasn't. I was just high 24/7.
Being a polyaddict in recovery, I found this part super relatable.
Well, for me, I practice complete abstinence. Okay, that's my program that I work. I don't debate any other program because I just don't have that luxury today. I just share what's working for me today, and that is 100% complete abstinence. Because I'm that kind of alcoholic, I'm that kind of drug addict. You give me a cookie, I'm gonna ask for a glass of milk. So, the only thing foreign that goes in my body that doesn't make my life unmanageable is caffeine. I can do caffeine and my life stays manageable. That's it. That's how radical I've had to become in my recovery. Because in the past, I used to, inch it forward and forward, and I would eventually, my brain starts telling me, you are ADD, you need to go take Adderall. What I've done today is changed my life, okay? If I have an attention deficit disorder, the way I increase my attention is to remove things out of my life, make my life more simple. The more simple my life is, the more attention to detail I become. The more stuff I put into my life, allow into my life, the more ADD happens. Okay, what happens is my brain starts going, and I don't feel like I can perform in each box perfectly. All right, so I remove things. Okay, as opposed to trying to spin all the plates, I would take drugs so I could spin all the plates. Well, what happens is I spin all the plates for just a short time. The drugs start taking over. I start dropping plates. I take more drugs to try to get the plates back up in the air. All right, so we call that ADD. I don't. I just remove stuff and make my life very simple today, and that's manageable. And I don't need Adderall to keep my life simple.
To conclude, a good metaphor for how to properly use ADHD medications is to think of them as a Band-Aid rather than a cast. A cast will heal what's broken, but that's not necessarily the job of prescribed ADHD medications. Instead, they should act as a Band-Aid, meaning to use medication in addition to other things to improve ADHD symptoms. While medications can provide relief, individuals are likely to thrive if they learn skills such as organization, time management, and self-motivation in addition to taking medications.